Hello and welcome to my micro-teaching session on the introduction to Botox. I'm going to tell you a little bit about myself to begin with, and then I'm going to ask you to tell me a little bit about yourself and your background and your previous experience coming today. My name's Tracy Whitton. My background is I've been a midwife for 16 years, and then for the last 12 years I've also been doing aesthetics. So I do basic Botox, advanced Botox, and the same with fillers, and I also do a lot of other advanced treatments. I'm also a nurse prescriber, and I've just now started to go into teaching. If possible, you could tell me a little bit about yourself, and then I will tell you a little bit about housekeeping next.
My name's Mandy Morgan. I have recently passed my level 4 in aesthetics and I'm now interested in taking that further, and I'd like to study Botox and then obviously come back and do the fillers as well. Obviously this is my first step onto being able to then move on to doing Botox as a full-time career.
Okay, thank you, Mandy. Right, I'll just go through a little bit of the housekeeping. So obviously from an exit point of view, you've got the front door and the back door. There's a toilet just here by the door, and there's also one up the stairs. We're going to have regular breaks. There's water, obviously you've got water, but if you need to fill your water up, there's water outside the room. Fire exit point of view is there's obviously exit again at the back and at the front, and we would all gather by the fence out at the front. If you do want to ask me any questions as we go along, feel free. I want this to be as interactive and as interesting as possible for yourself, so at any point if you need to ask me a question, then feel free to ask as we go along.
Okay, thank you.
Right, so I'll just get the slideshow up. So obviously, as I explained, this is the basic introduction to Botox. I'm going to next go through our aims and objectives. This is our first session. As the day goes along, we'll be doing obviously a lot more with regards to the treatment of Botox. I've got models coming in this afternoon, and we'll go up after this session. We'll be doing things like reconstitution, and then obviously we'll have a break and we'll go on to the live models. So this first session, I'm going to give you a basic understanding of what Botox is and how it works. I'm going to show you the history of the medical use of Botox, the brands of Botox which are on the market at present. We're going to discuss the muscles of the upper face, which you've already done in the workbook that I sent to you via the email, which I've had back and obviously I've marked for you. And I'm going to show you the standard markings on the face of where we're going to administer Botox. We've got a live model who we're going to mark up because I think it's a lot better to actually do it on a person rather than just obviously on a diagram. And then I'll highlight to you again at the end the objectives for our next lesson. So the basic question is, what is Botox? So it's a neurotoxin protein which is produced by the botulinum toxin A. It works by stopping the release of the neurotransmitter acetylcholine at the neurotransmission junction, and that in turn causes some paralysis of the muscle. It's an interesting fact, it's one of the most researched drugs on the planet, but it's actually a small amount would have a lethal toxin. It's the most lethal toxin known to man. Obviously you don't want to be giving that to your clients.
No, I did read that and I thought that was quite a funny fact.
Yeah, it's a funny fact, but obviously you wouldn't want to say that to your patient as they walk through the door. Right, so Botox use. So it's been used for many years for things like overactive muscle kind of tone, so muscular dystrophy, squint in children's eyes, and overactive bladder. So lots and lots of different reasons. Migraines, chronic pain, as a consequence of using it in bigger quantities in other areas. it was found then that it was really good for relaxing the muscle. The first person was a man called Richard Clark. He was a doctor, a plastic surgeon, and he was in California. And he was the first case to report botulinum toxin being used in an aesthetics reason. He treated a client who had a nerve paralysis on his left side of his face, and he realised at that point that toxin could be used to smooth out wrinkles. So it's had a licence since 2002 for the glabellar lines, which is obviously the lines here in between your forehead, which you've already obviously learned. No real reported adverse kind of consequences of having Botox on the upper face, but it's good to obviously show your clients that it's had 20 years now of use, and also the fact of how much research has actually gone into it. The other point, which is in your handout, is the fact that Botox only actually stays in your system for 72 hours, which is a really good selling point, because some people obviously, when they hear the word toxin, would be quite alarmed of the thought of having a toxin in their body for 12 to 16 weeks. Whereas if you could say it's only actually in your system for 72 hours, then that would give your potential future clients a little bit of reassurance.
Yeah, when I actually read that, I was quite surprised at that, because obviously, not knowing any different myself, I just assumed it was there for the whole time of the Botox. If your Botox wore off in 3 to 4 months, you had it there for 3 to 4 months. That was really interesting. Yeah, I think it is a really, really good selling point. Right, I've just got a little bit of a video. I chose this video because it shows you how the Botox blocks the message from the nerve to the muscle. But I think it's said in an easy way. What I want you to do, if you can, is to take some key points of what you would use from this video to obviously explain it to your client. It might take a few seconds with technology to get it on the screen, but hopefully.
Bacteria, Botox is one of the most poisonous substances in the world. It vaporized 1 teaspoon could kill millions of people because it stops muscle contractions. How would it kill? Well, one example, if we inhaled it and it got into our diaphragm, a muscle, we'd no longer be able to breathe. Skeletal muscles need nerve impulses to do anything. So Botox works simply by blocking nerves from sending their messages to the muscle. Here, at the nerve terminal, where the nerve and the muscle meet, the nerve would normally transmit the signal from the brain across the gap, called the synapse, and into the muscle. However, Botox blocks the release of the nerve signaling molecules, called the neurotransmitters. This means that the muscle would never receive the signal from the brain and will never contract. But when used in very localized areas of the body and in controlled situations, we can use Botox to target specific nerves, going to the specific muscles that we wish to prevent from contracting. That's how Botox works. Here are 5 areas where we can use this effectively. In cosmetics, when our skin gets squashed together due to the underlying muscle contractions, the elastic nature of it can be weakened and lines can form across the skin. We can target muscles of the face to stop them from contracting at all, so preventing the skin from being moved in this way. If we can't, for example, raise our eyebrows, then we can't form these lines where the skin has been compressed, so it would never lose its elasticity or form areas of weakness. Yes, you'll lose the ability to make some expressions, but it will also prevent the formation of visible wrinkles. The second is overactive bladder. Having an overactive urinary bladder means that your bladder might contract at inconvenient times, sometimes causing pain and sometimes causing incontinence. Surgeons can inject the walls of the bladder with Botox, preventing the muscle from ever
Obviously, this is more of a medic that would do this rather than us.
Bladder is made of
It's quite interesting though.
Yeah.
Always need nerve impulses to contract, but overactive bladder happens to be brought on by nerve signals, and so Botox works effectively in this case. The third is muscle spasms. Some severe neck pain or other disorders can be brought on by muscle spasms. Botox can prevent these muscles from contracting and alleviate these disorders. Fourth is migraines. Some muscle spasms can even result in migraines, headaches, or targeted, Botox can potentially clear these up as
This
well.
is a selling point for
The
yourself.
final use
Yeah.
is excessive sweating. Nerve impulses result in sweat glands being stimulated to secrete sweat. Because Botox prevents nerves transmitting signals, if you inject this into the areas where your nerves meet the sweat glands, you'll prevent those glands from ever sweating. So Botox is dangerous in nature, but really useful in the right hands.
So of course, you know, if you do advanced training, you can also offer that as well. Right, just give me a second to get out of this. Right, so I won't go through the muscle groups again because you've already done your workbook. But this is just to obviously show you how diverse all the muscles. But what you can see is all the muscles on the face are interlinked. They're not separate, so they all need to be treated as one entirety. So you have to be quite conscious of all the joining muscles to the areas you're going to treat. So vectors of the upper face. So the upper face is what we're going to be doing today, and it's really important that we know how the upper face muscles work. So for example, the glabellar region here, we know is a depressor, so it pulls down. The forehead muscles are an elevator, so they're naturally pulling up. Around the eyes here, they're actually doing a little bit of both, and it's important you know where the activity is in each muscle that you're going to obviously treat, which I'll explain now with the next slide. So we've already gone through the muscles, but the actions of the facial muscles that we're going to be looking at today. The first being the frontalis muscle, which is the forehead. It's obviously the expression lines that you get are the horizontal forehead lines, and as I just said, it is a brow elevator, so naturally it's lifting. It's your only elevator of your upper face, so it's lifting up. Your corrugator muscle, which is here, and that pulls your eyebrows medially, so pulls them inwards, and it causes the frown lines. You have your posterior muscle, which is this muscle in the middle, and your depressor muscles. So your brow depressor muscles are actually responsible for your frown lines, so like the 11 lines and the horizontal lines that you get across the top of your nose. And then you've got your orbicularis oculi, or your crow's feet, and they are actually depressors, and on the expression lines are the crow feet muscles, which a lot of people, obviously especially ladies as they get older, are really bothered about. Right, so as we've just talked about them, we will get our model in shortly, but the glabellar region is made up of the procerus, which is this muscle in the middle, and obviously the corrugators, which dip into the procerus. It's a deep muscle injection, which I will show you on our models later on, and it starts off deep and then it becomes more superficial, and then is even more superficial at the tail. You need to inject at least 1 centimetre above the orbital rim. You use your non-dominant hand just for support, but again, as I'll show you in a moment on the model, it will become a lot clearer to how we're going to do it. On females, you wouldn't inject past the mid-pupil line, just because naturally women have more of an arch on their eyebrow, but again, this will become a lot clearer when you see it on the model. The forehead is like a mid-depth of muscle you need to inject into. You've got your forehead, your frontalis muscle, you've got a left side and a right side, and you need to always ensure that you inject at least 2 centimetres above the orbital rim, because this is your elevator. So if you go too low, you could drop the eyebrows, because it will get heavier and drop the brow. And then lastly, we're going to look at the crow's feet, which is a superficial muscle. You need to be 1 centimetre away from the orbital rim of the eye, and you mark the upper border, the lower border, and then central. But I will show you this shortly. So as you get more competent, you really need to assess each person on an individual basis. I will give you a set procedure today, but because we've got our model that we can look at as well, you need to start thinking about that every person potentially can be slightly different, and their anatomy is going to be slightly different. And understanding how the muscles move, that's why I was talking about the vectors and what's an elevator, what's a depressor. You really need to be able to be aware of this in your mind when you're marking somebody up. And obviously, as we have our model this afternoon, I will go through assessing somebody's face as well, because obviously not everybody's going to be suitable depending on their face and how heavy their eyelids and different factors come into play. Obviously, generally men have a stronger muscle than a female, and there's always some element of asymmetry. Again, that's why it's so important that we always assess somebody on an individual basis.
So with a male, would you recommend that you'd use more Botox units than on a female?
Yes, definitely. Again, an average male sometimes can need double a female. So when you go into your pricings, you need to be really aware of the fact that you are going to need to have more Botox for a man. So the main 3 brands at the market at the moment are Allergan's Botox. That's been on the market the longest and has got the longest track record. You've got Merz and Bocature, which is I will go through reconstitution, but it's not mixed with anything else, so it's what they class as the purest Botox. And then you've got Galderma's Azalor, which again is just another brand. On paper they're all the same, they all do the same thing, but actually in practice you will find certain brands might work better on certain individuals, and as you get to know the brands, you'll get to know exactly which you prefer to use. But we will go through reconstitution on our next session because they can be quite different from brand to brand.
Well, do clients normally ask for a brand, or will you decide on that brand, or do you as a clinic just use whatever brand that you think is suitable?
It can be a mixture of both.
Yeah.
Some clients will come and had it before and they want a particular brand. Others will be led by you.
Yeah.
No, you'll find in practice everybody will go towards a particular brand. For example, we're going to be using Azalor this afternoon. I use that mainly because it starts working the quickest and I feel it lasts the longest. But I am going to train you in all different, the 3 different brands, just so that you can obviously try more.
Between the 3.
Yeah.
Yeah.
Right, so now we're going to go and get our model, and obviously we're going to mark up the face, and then after that what I'm going to do is give you a little bit of task of, you've got a picture here of the face, and I want you to do the basic markings, and obviously then we'll discuss it, if that's okay. I might need a few minutes to go get my model, so if you want to go to the bathroom or have a drink or stretch your legs, then feel free.
Okay, thank you.
My model's just come in. I'll just get some gloves. They're just out here actually, I'll just grab them. So this is Tyler. He is 27 and he's never had any Botox before. He's just had some gloves here. He's just deciding now that he's thinking of whether or not to just start having the beginning of Botox, just really as a preventative measure, which I am finding now that the younger generation are interested in having Botox. So you can take a seat for us, Tyler. I'll just move your desk out of the way so we can mark up. I'll just turn this so we can make sure. So he's never had any treatment before. So again, I'm just going to show you just by marking up. So Tyler, just frown for me. So go down. So can you see, obviously, that's the outer edge on each side. That's the posterior region. And then obviously we'd mark in between the two. So if you just frown again for me, please. So you can see he's got, you can see what result his posterior muscles having across the top here, and you can see his outer corrugators, and that's obviously the more superficial injection we're going to make. And if you can lift your forehead up, brilliant. So can you see now, obviously you've studied the muscles where you would inject, where you would obviously your mid-pupil. So do you want to start trying to mark, and we'll do it together?
Yeah. So obviously you've got to leave the 2 centimetres.
Yeah, exactly.
So I would probably, and then it's about 1 centimetre in between each one.
And you say he's only young, so you could do a little bit of a row in between. I'll mark this side out for you. But again, you do it on the muscle activity. I feel like with Tyler, it would benefit him to have a few higher up.
So I do them then. Obviously, you don't go into that area there because there's no muscle there and stuff.
Yeah, well done, because obviously you've learnt that from the workbook I've given you. And then if we can get you to smile, Tyler, screw your eyes up slightly. He doesn't seem to have many, so I think he would only need to have the basic amount.
Yeah, you can just see.
And because he's a little bit younger, you might not need to put a bigger kind of quantity.
Yeah.
So can you see now, if you lift up again, so you can see where we would go. If you frown again. Yeah. And then that's
on these lines here, can you see obviously it's got that like frown line there.
Yeah.
So would you, if somebody had them a little bit further in, would you take the injection slightly in, or would you still keep them more like spaced out as they are?
Probably where they are, because that's where it's obviously the corrugator's dipping into the posterior. So and then you review it at 2 weeks anyway. Yeah. Right. So we'll just take all those markings off Tyler, and then we'll let him go, and then we'll discuss it. I think
there's some on the windowsill, I think.
This is on the windowsill. Okay. I'll just wait a second. So Tyler will be coming this afternoon for our afternoon session, so you can actually, now we've marked him out, you'll be able to use him as your first model anyway later.
Would there ever be a case that somebody would come, and obviously the fairly young like Tyler is, that you would say, no, I don't want the Botox?
Exactly. You know, at the end of the day, Tyler at rest has got no static lines as such. So static lines like we did from the workbook are lines which are there without movement. He hasn't got any, so his are only dynamic lines. So he's only doing it as a preventative. But if, depending on the patient and why they're having it, then you have that clinical decision to decide alongside the patient whether or not you feel like they're suitable. Right, brilliant. Thank you, Tyler. I hope you found that useful.
Yeah, it is actually, to see it actually in action.
And then obviously we've got 6 models coming this afternoon, so we'll do a lot of marking out and we'll go through it all again. So you've got your picture there. So like obviously you've already done that revision, so if you could try and mark out where you think, you know, like a standard injection would be. And I'll just go back to make sure we've obviously done our aims and objectives.
kind of the standard one, but obviously I understand that depending upon their age, I may need a little bit more around
Yeah.
the eye, and obviously on this as well, whether or not.
Exactly. So yeah, so exactly, you've done really well, and you say because you did really well and did your workbook in advance.
Yeah.
Like you can see, like I've said, you have a standard dose on the glabellar area, which you've shown me there. We'll go through reconstitution and how much you actually inject in each site later.
Yeah.
And again, with the crocey area, you can mark the upper, the lower and in the middle, but everybody, there is a variation to that on each person. And again, the forehead, there's a standard one that you can do, or that you've marked out, and what we did with Tyler, depending on where his muscle activity is, we marked it more like this, didn't we, the top one. So again, I will teach you the basics, but however, we've got lots of models in, and the importance of this is that everybody's different.
Yeah.
So I will show you the standard basic amount, but actually there's always a variation which you really need to be aware of. And luckily, obviously you've got today, and we've also got tomorrow as well, so it's really important that we get lots of models in, and you can see that variation that occurs between person to person.
Yeah, I think it's good that you've also got male modelling, because obviously you did tell me that you needed a lot more units, but obviously seeing it will obviously help.
Yeah, exactly. Right, so all we're going to do now is I'm just going to recap that we've met. So obviously we've met our aims and objectives. I've given you a basic understanding of Botox, how it works. We've gone through the brands on the market, and we've discussed the muscles of the upper face. We've obviously marked out on Tyler, and obviously now I just want to talk about our next lesson. So we're going to have a break in a moment.
Yeah.
And then once we've had the break, we're going to do reconstitution. So we're going to get the 3 brands of Botox, we're going to reconstitute it, and we're going to talk about how much you would put in each area. We'll be doing that up to lunch, and we'll revisit obviously different patterns, and then after lunch we'll actually get our live models in. Do you have any questions or anything from the first session we've done?
No, I found it very informative, and I'm just quite excited now to actually put it into place. Yeah, obviously with you sending the workbooks through and everything, it gave me a greater understanding of the principles of it anyway, whereas this is now more the practical side.
Yeah, more hands-on. Even so we have to go through a little bit of theory, I really want today to be more interactive and more about hands-on practical, because this is a practical skill that you're learning. I have got a feedback form. Obviously I won't expect you to fill it in now, just to give me feedback and obviously what went well for you and other things so I can improve obviously for future teaching, if that's okay with you.
Yeah, no, that's great. I'd found that the workbook was extremely informative, and I did spend quite a few hours learning all the different facial muscles, but obviously I want to be able to put all this into action, and without doing that I wouldn't have been able to. So yeah, I've really enjoyed it.
Brilliant. So this is the end of our first session.